Video game addiction symptoms and treatment. Video game addiction is not currently recognized as an addictive disorder in the Diagnostic and Statistical Manual of Mental Disorders, the definitive guide to psychiatric illness. But an obsessive preoccupation with games at the expense of real-life activities or obligations shares some of the characteristics of addictive behavior. How can a parent tell when gaming has stopped being simple entertainment and become an addiction? Here are a few of the key warning signs to watch for. Poor performance at school, work, or household responsibilities as a result of a preoccupation with gaming, neglect of other hobbies or friendships, a decline in personal hygiene or grooming, inability to set limits on how much time is spent gaming, signs of irritability, anxiety, or anger when forced to stop gaming, even for brief periods of time, the need to spend more time playing games or to play more intensely in order to get the same level of enjoyment, symptoms of physical or psychological withdrawal, such as loss of appetite, sleeplessness, agitation, or emotional outbursts if the game is taken away, using video games as a way to escape stressful situations at work or school, or conflicts at home. Children and teenagers aren't the only ones who can be vulnerable to video game addiction. Adults may also play video games for hours instead of engaging in work activities, pursuing hobbies, or devoting time to their partners or children. When adults are no longer able to control the amount of time they spend on video games, or when their jobs or relationships begin to suffer as a result of video gaming, they may have crossed the line from recreation to addiction. Health risks and concerns. Compulsive video gaming can have negative effects on a developing mind or body. Adult players, too, may suffer from the effects of hours spent sitting on the couch or at a computer desk. Listed below are a few of the key concerns for younger players. Sedentary lifestyle. Hours spent sitting at a computer or in front of a device can take a toll on a young person's body. The lack of physical exercise involved in video gaming has led to public health concerns about weight gain, poor posture, and an increased risk of type 2 diabetes in America's children and teens. Lack of social engagement. Although video games require engaging with others in computerized environments, they don't necessarily prepare children for the realities of socializing with their peers. Learning how to interact with others in a real-world setting is an important social skill that may be neglected by individuals who spend too much time gaming. Problems with concentration and attention. There is some concern that the rapid movements and fast-paced action of video games promote a loss of concentration in players. Children who spend a lot of time playing video games may become less interested in reading books, for example, which requires more focused, prolonged attention. Avoidance of developmental tasks. Adolescence is a time of self-discovery and personal development. In order to become mature adults who can take on the challenges of life, teenagers must learn how to confront painful emotions and awkward social experiences. When used appropriately, fantasy role-playing video games can help children learn and apply valuable character traits that may help them in their interactions with others. But when video gaming is used as an escape mechanism, it allows children to avoid the developmental challenges of growing up. Increased aggression or violence. Children and teens who devote a lot of time to playing video games that focus on combat, fighting, or violence may display more signs of aggression than those who don't play these games. Parents must be aware of the content of video games, which are subject to a rating system similar to the one applied to films. The Entertainment Software Rating Board (ESRB) posts guidelines and ratings for popular games based on the age of the player, as well as educational resources for parents and parental game controls. Seizures and repetitive stress injuries. The British Medical Journal (BMJ) published an article about the risks of video gaming for players who have epilepsy or other seizure disorders. The flickering graphics, lights, and colors of video game displays may trigger seizure activity in some players. There is also evidence that compulsive game playing may lead to repetitive stress injuries of the wrists or hands.